This bill will create a new government bureaucracy to decide which procedures will be covered, which doctors you can see, who will get that care. They say you have options, but the fact of the matter is, and I have read this 1,000-page bill, that you either go, I've done what most members of Congress probably haven't done. They say you have options, but the fact is you either go on the public option or you go on the private plan dictated by the government, and that's not health care choice. It isn't American.
We do not have a failure of a free market. We have a failure of decades of political interference in medicine. Make no mistake, there will be health rationing if Obamacare goes through. What we need is to return to freedom and individual rights in medicine.
I discovered a few months ago that the procedure I had, because it was leading edge and very risky, there's not a lot of it done, so no one knows the full impact of what happens, is that if I had been on Medicare at the time of my surgery, I would not have been allowed to have the operation. It would have put me back to chemotherapy.
Implementation of a public option is the first step towards a single-payer healthcare system, which is available, of course, in Canada and Europe, where fewer procedures are covered, where wait times for consultations and surgeries are significantly longer, and where government bureaucracy is rampant. Is that what we want?
No! Before you vote, we demand you read the bill. Before we embrace government-run health care, we need to ask a simple question. How is the health care that government already runs? Ask those people on Medicare. Ask those people on Medicaid. How is government-run health care working for you? I think of a friend up there who had cancer, had a brain tumor. He had to come down here to get it solved. It was a 4.5-month wait for his MRI, a 4.5-month wait for his surgery. There was a broker up in Calgary, actually in Vancouver, who helped arrange him to come down to the safe United States, was taken care of in a week. It saved his life. When I talked to the broker, he looked at me and he said, please, whatever you do, don't do what we did in the United States. And I expected him to say, because if you do, you'll die too. He didn't. He said, because if you do, we will have no place to escape to.
I, like most Americans, do not support the big government solution of Barack Obama. This plan and the public option that it creates will, like Medicare does now, ration care. Go out there, go forward as Americans, fight this battle, win this battle, because our army is strong and our convictions are powerful. We stand for America and we fight for America. Thank you for coming today.